You ready? Okay. Good afternoon, and thank you for joining us for this community briefing on COVID-19. Joining me once again is interpreter Margie Propp, and thank you so much, Margie, for providing your services. Before we begin our discussion of the latest COVID-19 information, we once again want to thank our entire community for the outpouring of love and support for investigator Mario Herrera and his family. It's remarkable to see the way our community has rallied around him as he remains in critical condition at UNMC. We join everyone in sending our heartfelt wishes for his full and rapid recovery. And as we work to protect the health and safety of all of our community members during this pandemic, we want to remind you, of course, that you can find the latest information at our website, covid19.lincoln.ne.gov. There's a dashboard there with the latest COVID-19 data, and we update it daily at about this time. And at the website, you will also find our COVID-19 risk dial, a color-coded tool that communicates the level of risk of spread of COVID-19 here in Lincoln and Lancaster County. We update the dial each Friday, and this week, the dial is moving from low orange to mid-orange, signifying that the risk of the virus spreading here in our community is higher than it was last week at this time. Today, an additional 89 individuals in Lincoln and Lancaster County have tested positive for COVID-19. The total number of lab-confirmed cases now stands at 4,397. Our total recoveries identified to date are up from 1,876 to 1,972. Scott Holmes is here with us today. Scott is the manager of our Environmental Public Health Division at the Health Department, and he will provide more information about the indicators that are used to determine the position of our risk dial. Over to you, Scott.
Thank you, Mary. Good afternoon. The Health Department uses 3 weeks of data in 5 primary areas to determine the risk to the public. As we have recently been reporting, it is very concerning to us to see the current data moving in the wrong direction. So far this week, we've had 430 cases. That is already 90 more than the 340 reported last week, and we still have another day to go. It is also a new high for weekly cases. The previous high was 360 cases for the week ending July 25th. As mentioned previously in previous briefings, the recent large increase in new cases is largely due to students returning to local colleges and universities. Over the last 2 weeks, about 50% of all cases were associated with UNL. UNL has a large population and has been impacted the most, but we are also working with our other campuses, and they are seeing spread of the virus as well. To date, we have identified 53 cases associated with Nebraska Wesleyan University, and we will share more information as further investigations are completed. In addition, for the week ending August 29th, 31% of the new cases were among 18 and 19-year-olds, many of whom are incoming first-year students. So far this week, that trend continues with 30% of new cases among 18 and 19-year-olds. For context, 18 and 19-year-old age group makes up only 5% of new cases before local colleges started classes. The 7-day rolling average number of cases also shows how quickly our local situation has changed since college students returned to Lincoln. In mid-August, about 1 month after our mask requirement was put in place, the average was mostly in the low 20s. Since then, the average has increased, hitting an all-time high of 71 on September 2nd. With the new case counts in the 80s, 90s, and higher, we expect the average to continue to increase through the end of this week. The average weekly positivity rate has also gone up from 6.8% the week ending August 22nd to 10.5% the week ending August 29th. The increase is largely due to the increased testing of college students who are at higher risk of contracting the virus due to their social activities. The weekly positivity rate so far this week is 13.4%. At this time, we continue to have no confirmed transmission of the virus in any school or classroom setting of any level of education institutions in Lancaster County. This data continues to support the effectiveness of measures that were put in place to protect students in school and staff. The new cases are due to the increased social activities outside of the school setting. As of today, nearly 61,000 people have been tested in Lancaster County, and testing remains widely available in the community. So far this week, about 3,200 people have been tested. We do anticipate additional testing being done at area colleges. The University of Nebraska has announced a plan to expand testing availability on campus beginning next week. The turnaround time for receiving tests has been steady overall. Over the past 3 weeks, the average turnaround time has been about 2.6 days. So far this week, the average is just over 3 days. Again, the ideal test result turnaround time is within 24 hours, as this increases the chances of preventing spread of the virus. Throughout the pandemic, labs have struggled to reach this turnaround target. Despite the challenge with lab capacity in testing turnaround times, our health department continues to maintain a robust contact tracing capacity. Over the past 3 weeks, our nurses have been able to complete 90% of their investigations within 24 hours. And that timeliness matters greatly to our success in contact tracing process. This past week, ending August 29th, 93% of the investigations were completed within 24 hours of the health department receiving the lab report. The number of COVID patients in Lincoln hospitals has been trending higher the past few weeks. The number has increased from 10 patients on August 29th to 32 patients reported today. 8 patients are from Lancaster County and 24 are from other communities. This is the first time since June 6th that we have had more than 30 COVID-19 patients hospitalized. On June 6th, we had 35. We also want to note that over the past weekend, Lincoln's ICU bed capacity dipped just below 30%. We will monitor this situation closely. If the overall number of hospital patients is high and additional COVID-19 patients require hospitalization in the coming weeks, we could begin to see a strain on our local hospital systems. Again, the position of our risk dial is determined by 3 weeks of data on multiple indicators. This map shows how those metrics are plotted on color-coded risk areas to show why the dial has moved to mid-orange, or still in the high-risk level. Toward the bottom left, you will see that testing availability remains in the green. Toward the middle, you will find the ICU availability and contact tracing in elevated yellow. Toward the upper right, we see that all the following metrics are in the orange: new cases, community spread, hospitalizations, average testing turnaround time, and the positivity rate. You will find the new location of the risk dial, represented by the blue square outlined in red, near the mid-orange section. Our primary concern at this point in the pandemic is that the spread of COVID-19 among college students could impact a greater proportion of older adults in Lincoln who are more likely to have more severe illness. We know that college students don't just stay within their campus communities. In fact, the majority of college students don't live on campus. They are a welcome part of Lincoln's community where they live, work, and play as we do. Many work in the places that we may go, such as retail stores and restaurants. We want to emphasize that the increase in new cases is not only a college campus concern, it is our entire community's concern. To effectively address this, we must all take care of ourselves and each other. When we work together, we can help Lincoln be safe from the spread of COVID-19 and be on a path to recovery. Please wear a mask. Everyone is required to wear a mask in all indoor areas open to the public when unable to maintain physical distancing of at least 6 feet from another person. We need to maintain a physical distance of at least 6 feet, even when we are in outdoor gatherings. Practice good hygiene. If soap and water are not readily available, use alcohol-based sanitizer containing at least 60% alcohol. If you don't feel well, stay home. Before heading out, take your temperature and check yourself for symptoms. If you're concerned, get a test. With these simple common sense precautions, we can protect ourselves and our community. Mayor?
Thank you, Scott. This weekend, our nation celebrates the foundational contributions of workers. And as we celebrate Labor Day, in the spirit of this holiday, let's protect each other's health and safety. After other holiday weekends this year, such as Memorial Day and the 4th of July, data that we track 2 to 3 weeks later showed spikes in cases both locally and nationally. For example, here in Lincoln and Lancaster County, we had 169 cases for the week ending on July 4th. But 2 weeks later, we were at 334 cases. And 3 weeks later, we reached a peak of 360 cases for the week ending July 25th. In short, we are concerned that this holiday weekend could lead to an additional spike in cases, similar to what we saw after the 4th of July. As we take a break from our labors this weekend, we must not take a break from the work to defeat this virus. Here's how we can all do our part. Avoid large crowds. Wear a mask. And if you do have a small gathering, provide a few extra masks for guests who don't have one or forget to bring one of their own. Keep your gatherings outdoors and arrange tables and chairs to allow for that 6-foot physical distancing that Scott mentioned. Make hand sanitizer available to guests. And be careful how you serve food. Provide individual portions rather than family-style buffets. The general rule of thumb we want everyone to remember is this: the more closely that you interact with others, and the longer your interaction lasts, and the greater number of people involved in that interaction, the more likely the risk of COVID-19 spread. The impacts of this weekend, though, are ours to decide. I know Lincoln's residents have the compassion and understanding to continue to do the right thing, to protect ourselves, our friends, our families, and our neighbors. We're pleased today to announce some additional good news. We have another drive-through career fair. This one will take place on Tuesday, September 10th from 2 to 6 p.m. at Gateway Mall in the Sears parking lot. Job seekers may drive up and receive a bag filled with information from over 35 Lincoln companies that are hiring right now. More information can be found on the Resident Resources section of our website. That's covid19.lincoln.ne.gov. And we want to thank the Gateway Mall, the Lincoln Partnership for Economic Development, EmployLink, and the Center for People in Need for making this reemployment opportunity available to residents in our community. With that, we'll open it up for questions from the media. Any questions today?
Hi, Mayor. This is Matt Olberding from the Journal-Star.
Hi, Matt.
Hi. So do you, despite the high number of cases, do you feel, I don't want to, good's probably not the right term, but do you feel okay about the fact that spread doesn't seem to be occurring within classroom settings at LPS or at colleges?
Yeah, I appreciate that question. Here's where, obviously we're concerned about these cases because they have the potential to break down the progress that we've made. But there is good news. All of the preventative measures that were put in place in our public schools and other local area school districts are proving to be effective. We are not seeing spread inside our school systems. And when we disaggregate the numbers, when we look at the number of cases that are in our community as opposed to those individuals associated with our colleges and universities, they're kind of holding steady at where they were before we saw this spike. And I can let the health department speak more to that. But those are some reassuring pieces of data that help us know that the preventative measures of washing hands, wearing masks, keeping a distance, and all the other kinds of administrative and engineering controls that are in place in schools to protect students and staff, they're working. We need to continue to employ them and to be faithful to these practices because they empower us. We have power over this virus. If we continue to use our power, we will prevail. Any other questions?
Do you need me to roll?
Hi, Mayor. It's Mackenzie from 1011. How are you?
Hi, Mackenzie. I'm well, thanks. How are you?
I'm good. I just had a question. Do you know why the number of hospitalizations is going up so much for out of county patients here in Lincoln?
I'll let the health department take that question, but you know, we are proud to serve other communities. That's always been a part of our plan, is to welcome those who may not have resources in their community and provide that kind of excellent care. And I just want to again praise all of our medical professionals. They are healthcare heroes who are making a difference, not just for those here in Lincoln and Lancaster County, but for those people across the state who come here for care.
Hi, Mackenzie. Great question. So Lincoln has always served as a regional resource when it comes to medical care. And we serve an area that we believe is at least 450,000 people, not just the 300 and plus that are in Lancaster County. Bryan Health has multiple branches in multiple areas of the state. And so when there are patients that need higher level care, it's not uncommon for them to be brought to Lincoln. The other factor is, of course, that there is more COVID-19 in the rest of the state also. It's not just here. And so we are seeing more cases in some of the rural areas than we're seeing in the past. And those hospitals may already have patient loads that they cannot handle additional patients, but Lincoln can. So that's why you're seeing the patients come here.
Thank you.
You bet.
One other quick question for you, Scott. Do we know if any of the UNL students were hospitalized, or if anyone in kind of that age range is hospitalized?
I'm sorry, Mackenzie, I don't have that information today.
Thank you.
You bet.
Are there other questions today? All right. Well, if there are no further questions from the media, I just want to thank you all for joining us today. And thank you for wearing your masks, washing your hands, and watching your distance. Please continue to do so over the holiday weekend. It really will make a difference in helping to protect our friends, family, neighbors, and this entire community. Take care.